Oral health evaluation. Oral cancer screenings save lives. 2% of all cancers diagnosed are oral cancer. Approximately 40,000 people per year are diagnosed with oral cancer. 7,800 people will die from oral cancer, and on average, 60% will survive more than 5 years. Your patient assessment begins as soon as the patient enters the office. You want to be noticing how the patient's breathing, their posture, and how they're moving. It is important to obtain a full medical history to identify any early detection. Risk factors for oral manifestations include patients with increased sun exposure, tobacco or alcohol user, older patients, patients with HPV, malnutrition, or pregnant patients. It is important to take your patient's vital signs so you have them as a baseline, and always remember to place the proper PPE. This clip will show you how you should be seating your patient and observing them at the same time. The next step is to begin your extraoral exam. The operator position is standing and the patient position is upright. The clinician will visually examine the head, face, eyes, and neck, noting symmetry, scars, tattoos, and piercings. The clinician will bilaterally palpate lymph nodes and facial key points, including the pre- and post-auricular nodes, occipital node, anterior and posterior cervical chain, the supraclavicular nodes, submandibular and submental nodes, the parotid gland, the thyroid, and the TMJ, all of which will be demonstrated in the following clip. Have your patient take a sip of water and observe as they swallow. Then palpate the thyroid gland. Observe their TMJ by having them open and close their mouth and moving it right to left. Next, you want to begin your intraoral exam, starting with the labial and buccal mucosa. Visually examine the lips and retract them to reveal the labial mucosa. Palpate all mucosa and examine the frenum attachments, including central, maxillary, and mandibular. Next, retract the cheeks to reveal the buccal surfaces. Palpate and examine the frenum attachments. Lastly, using a 2x2 gauze, check the Stenson's duct production on both left and right sides. Moving on to the tongue and floor of the mouth. Examine the patient's left and right side of the tongue. Then have them put their tongue to the roof of their mouth so you can see the underneath and evaluate the ventral and lingual frenum attachments. Have the patient extend their tongue outwards, revealing the dorsal surface. With the tongue extended, palpate the lateral borders, dorsal, and ventral surfaces. Using bimanual palpation, palpate the floor of the mouth. Evaluate the sublingual gland left and right, and using a 2x2 gauze, check salivary flow. Next, examine the gingiva and alveolar mucosa. Examine and palpate the alveolar mucosa and attached and marginal gingiva. Notice any exudate, sinus tract drainage, or fistulas. Lastly, examine the hard and soft palate, maxillary tuberosities, retromolar pads, and the pharynx. Examine the hard and soft palates, noticing any fistulas, exudate, or lesions. Next, palpate the hard palate for palatal tori. Evaluate and palpate left and right retromolar pads and maxillary tuberosities. Examine the pterygomandibular raphe, posterior pharyngeal wall, palatal glossal and palatopharyngeal pillar, palatine tonsils if they are present, and the uvula. The following are considered variations of normal and should still be documented. Tori on the hard and soft palate, as seen on the soft palate in the picture, melanin pigmentation, fissured tongue, lingual varicosities, and Fordyce granules. The most important thing is documentation. All lesions should be noted in the patient's chart, including size, color, shape, and also take a picture. Remember, documentation is key.